I have Brain Treatment Center Dallas, where a friend of mine, Dr. Hal Urschel, understood or kind of researched the MeRT protocol that we use there and wanted to implement it at Enterhealth. And so kind of simultaneously, we launched MeRT at the same time, him for addiction, me for autism. And our worlds kind of combined after that with a mutual interest in the fact that we could actually heal brain pathology. One of the things that catches me about the Enterhealth patients when it comes to their addiction journey or their solving of their addiction journey as opposed to other companies that don't use MeRT or any kind of neuromodulation is that these patients oftentimes don't come back because they don't have return to addiction. In my experience, I have not had a repeat customers like I have with other addiction facilities, which are abundant in the Dallas area. And so it gives me pause, makes me curious about exactly what's going on here that is not going on at other rehab facilities. Why is there such a success rate? And what's different? Well, MeRT was definitely one of those. The approach of the whole body, the whole health, the whole environment that Enterhealth also utilizes to get their patients better is also of great interest to me, because we oftentimes, will have somebody heal, but if they go back to a broken world, then it's easier to fall back into a broken, brain state. And so having everything kind of fixed, nutrition, who do you follow up with? What does it look like in the follow-up setting? How long do you need to follow up? What do you do when you're done with follow-up and outpatient treatment? Do you go back to work, and how does that look? All of that's addressed, and so it makes it more of a successful journey for the patient rather than you were here for 5 days, you're no longer using the drug, you're good to go. I think that the focus on mental health is just as important, if not more important, than focusing on just the addiction. You were already doing it, now you're making it much more robust. You're actually focusing on nutritional aspects, mitochondrial aspects, all the needs of the body for nutrition and health are now going to be addressed, not just what medication can we give for this receptor that might be messed up or going haywire. And so having the ability to treat the gut, which is extremely important to the health of the brain, is something that your functional psychiatrist will do that other psychiatrists may not be looking at. They may be looking at which receptors and which medication, and that one didn't work, so let's try something else. What's nice about focusing on the root cause of, for instance, what is causing the attention deficit, what is causing the depression, what might even be causing the addiction or the propensity to fall into an addicted state, rather than treating the end result, figuring out how to stop it from happening in the first place is really what you guys are focusing on. And I think that Enterhealth has a huge opportunity to open a whole new world for health rather than treatments. It's more of the journey of getting better, not the journey of treating what's broken.